When a bony injury is suspected, the physician should assess for the following in the injured extremity: violation of the skin, discoloration, or obvious deformity, passive and active range of motion in the area proximal and distal to the injury, tenderness, and neurovascular status to include motor function, sensory function, as well as pulses and capillary refill. Diagnosis of a distal radial fracture is primarily made through imaging. Radiographs for evaluation of an injured forearm must at minimum include a posterior, anterior, and lateral view. Additionally, the joints above and below the fracture should be imaged due to the possibility of injury at the proximal or distal joint with a long bone fracture. CT can be useful for evaluating articular involvement and may affect decisions regarding treatment. The gold standard for treatment of non-displaced and stable distal radius fractures is closed reduction. Fractures with minor communication or that are minimally displaced can also be considered for closed reduction. A closed reduction of a distal radius fracture aims to place the fragments back into alignment and then use an immobilization method that will hold the reduction in place so that the fracture can heal and normal function is restored. Before reducing the fracture, the patient should receive treatment for pain and muscle spasm. With the help of an assistant holding the elbow to provide countertraction, supinate the forearm while applying longitudinal traction to the distal fragment. Next, apply dorsal angulation, accentuating the fracture pattern to disimpact the fracture. Lastly, pronate the forearm and wrist and apply ulnar deviation to correct any radial and dorsal angulation. Hold the fracture in this position while a sugar tongue splint is applied. Perfect alignment is not necessary. When placing the sugar tongue splint, the patient's elbow should be in 90 degrees of flexion. Be sure to measure out enough splinting material for the splint to cover the metacarpal heads as well as the dorsum of the hand. The wrist should be in a neutral position or slightly extended 10 to 20 degrees. Try to mold the splint with the palm of your hands and less with your fingers to avoid any potential pressure points when the splint hardens. Ensure that you check a post-reduction X-ray to evaluate for fracture alignment as well as perform a repeat neurovascular exam. An alternative methodology for reduction of a distal radius fracture includes the use of finger traps. Equipment needed for this includes the finger trap device, an IV pole, stocking net or curling scows, and a weight, which in this case is 2 1-liter saline bags. Setup is quite simple. Have the patient sitting and place one finger trap over each digit. Adjust the bed height such that the patient's elbow is bent at 90 degrees lateral to the body. Use curlings or other soft material to serve as a sling that will be placed on the patient's bicep with the weights applied to either end. Have the patient hang in the traps for about 15 to 20 minutes. Conveniently, they are well positioned to be splinted in a sugar tongue splint. Do not remove the patient from the finger traps until the splint is complete. During a distal radius fracture reduction, restoration of alignment is an important criteria because an articular step-off greater than 2 millimeters increases the risk of post-traumatic arthrosis by almost 100%. Initial reduction need not be perfect, as your patient should follow up in the orthopedic clinic within a week, during which they can be reevaluated for repeat reduction if necessary. 22% of cases involving high-energy trauma may involve median nerve compression. This will affect sensation to the palm of the hand and the first 4 digits. This highlights why emergent consultation is necessary if any neurologic deficit is present. Additionally, ulnar styloid fractures commonly occur with distal radius fracture and can cause distal radio-ulnar joint instability if the ulnar styloid fracture involves the insertion of the radio-ulnar ligament. Thank you so much for tuning in today. We hope that was helpful and look forward to having you on for future videos.